Common behaviors of those with borderline personality disorder, BPD. Individuals with borderline personality disorder, BPD, often exhibit a range of behaviors that are a direct result of the intense emotional experiences and difficulties they face in regulating their emotions. These behaviors can vary in intensity, but they frequently cause distress both for the person with BPD and for those around them. Understanding these common behaviors can help individuals and loved ones better navigate relationships and support one another in managing the disorder. 1. Impulsivity and risk-taking behaviors. One of the hallmark traits of BPD is impulsivity, which can lead to risky behaviors that may seem reckless or self-destructive. This impulsiveness is often a way of coping with emotional pain or anxiety, as individuals with BPD may seek immediate relief from overwhelming feelings. Examples of impulsivity: substance abuse, drugs, alcohol, reckless driving, unprotected sex or multiple sexual partners, binge eating or engaging in other extreme behaviors related to food or exercise, spending sprees or financial instability. Key insight: these impulsive behaviors often occur in response to emotional dysregulation and can provide temporary relief from negative feelings, but they often result in regret or self-blame afterward. 2. Intense and unstable relationships. Individuals with BPD often have intense and unstable relationships, characterized by dramatic shifts between idealization and evaluation. They may view others as either all good or all bad, and their perception of relationships can change quickly. Idealization: at the beginning of relationships, they may place someone on a pedestal, viewing them as perfect or the only source of validation. Devaluation: when their needs are not met or they feel abandoned, they may shift to viewing the person as flawed or untrustworthy, leading to emotional anger or resentment. Key insight: this pattern of behavior is often linked to the fear of abandonment and the need for emotional validation, which can cause significant strain in relationships. 3. Fear of abandonment and rejection. Individuals with BPD often experience an intense fear of abandonment or rejection, which can lead them to engage in behaviors designed to avoid being left alone or feeling rejected. This fear can manifest in both real and perceived threats of abandonment. Common behaviors related to fear of abandonment: clinging to relationships or becoming overly dependent on others. Intense emotional reactions to perceived signs of rejection. For example, if a partner is late, they may think they are being abandoned. Testing others: they may deliberately push people away or test them to see if they will stay, often leading to arguments or the exact abandonment they fear. Key insight: the fear of abandonment often drives people with BPD to act in ways that paradoxically create distance in relationships, as they may push others away when they fear being left. 4. Self-harm and suicidal behaviors. Self-harm and suicidal behaviors are common in individuals with BPD, especially during moments of emotional crisis. These behaviors are often a way to regulate overwhelming emotions, distract from emotional pain, or feel a sense of control over a chaotic emotional state. Examples of self-harm behaviors: cutting or burning oneself, hitting oneself or engaging in other forms of physical harm. Suicidal ideation or attempts, often in response to perceived rejection or overwhelming feelings. Key insight: self-harm and suicidal thoughts are typically expressions of deep emotional pain and cry for help. People with BPD may feel that these behaviors are the only way to express or manage their pain. 5. Chronic feelings of emptiness. A pervasive sense of emptiness is a common experience for many individuals with BPD. This feeling of being emotionally hollow or unfulfilled can be constant and may drive the person to engage in unhealthy behaviors in an attempt to fill the void. Common behaviors linked to emptiness: excessive reliance on relationships to fill the emotional void. Overeating or engaging in other unhealthy behaviors as a form of self-soothing. Chronic dissatisfaction with life and seeking temporary distractions. Key insight: the emptiness felt by individuals with BPD often stems from poor self-image and a lack of internal emotional stability, which can lead to behaviors designed to distract from or avoid dealing with this feeling. 6. Mood swings and emotional volatility. Rapid mood swings are a hallmark of BPD, and these emotional shifts can happen quickly and unexpectedly. One moment, A person with BPD may feel elated, and moments later, they may feel despondent or angry. These emotional fluctuations are often intense and difficult to manage. Mood changes can be triggered by minor events or interactions that may not seem significant to others. Rejection or perceived abandonment. Feeling misunderstood or invalidated. Key insight: emotional instability can make daily life challenging for those with BPD and for their loved ones, as their reactions to situations may seem unpredictable or disproportionate. 7. Chronic anger or irritability. Individuals with BPD often struggle with intense anger, which can be triggered by feelings of rejection, misunderstanding, or helplessness. This anger can often be out of proportion to the situation, and individuals may find it difficult to control their emotional outbursts. Examples of anger-related behaviors: explosive outbursts or lashing out verbally or physically. Irritability or quick temper in response to minor inconveniences. Difficulty calming down after anger is triggered. Key insight: the inability to regulate anger often leads to conflict in relationships and can result in self-blame or guilt after an outburst. 8. Paranoia or dissociation. During times of stress or emotion overload, individuals with BPD may experience paranoia or dissociation. They may feel disconnected from reality or have thoughts that others are trying to harm or reject them, even if there is no concrete evidence of this. Symptoms of paranoia or dissociation. Unfounded suspicions about the motives of others. Feeling detached from one's own body or thoughts. Feeling like one is in a dreamlike state. Key insight: these experiences are often a reaction to stressful situations or a reflection of deep emotional pain, and are typically alleviated with proper treatment, such as therapy. 9. Difficulty with identity and self-image. People with BPD often struggle with a fragmented sense of self. They may feel uncertain about who they are or experience frequent changes in self-concept, which can lead to confusion about their goals, values, or relationships. Common behaviors related to identity issues. Frequent changes in personal goals, career choices, or friendships. Uncertainty about sexual orientation, career path, or life direction. Extreme changes in appearance or self-presentation, for example, changing hairstyles or clothing style. Key insight: difficulty with identity often stems from low self-esteem and a lack of emotional stability, making it difficult for individuals with BPD to form a consistent sense of self. Conclusion: the behaviors exhibited by individuals with borderline personality disorder, BPD, are often reactions to intense emotional distress, a fear of abandonment, and a lack of emotional regulation. These behaviors can be challenging for both the individual and their loved ones, but understanding the root causes of these actions can lead to greater empathy and better management of the disorder. Therapy, particularly dialectical behavior therapy, DBT, cognitive behavioral therapy, CBT, and support networks, can help individuals with BPD reduce impulsivity, improve emotional regulation, and build healthier relationships. With appropriate treatment and support, individuals with BPD can learn to manage their behaviors and lead more stable, fulfilling lives.